So angina is chest pain, so central chest pain that's caused by an inadequate blood supply to the heart. So generally that's caused by a disease process called atherosclerosis, where you get narrowing in the arteries that supply your heart with blood. Very often, angina is diagnosed just from a clinical history. So when patients tell you their story, that is very often enough to say you have a clinical diagnosis of angina. Occasionally, we have to do some extra tests, whether they're blood tests or an ECG, and sometimes we do more invasive tests, so a CT coronary angiogram or an invasive coronary angiogram. But within that series of tests, we would then have an answer as to whether someone has angina or not. When patients are diagnosed with angina, very often the treatment involves medications. So there are very simple tablets that have been around for a long time, which are very safe and effective at relieving the symptoms of angina. Occasionally, tablets aren't enough, and in those patients, people go on to have other procedures, so coronary angiograms, and then an angioplasty or a coronary artery stent. Very occasionally, patients have to have even more invasive treatments. So by that, I mean cardiac surgery with a bypass operation. Sometimes patients have coronary artery disease that doesn't respond to treatment just with medications. This can be due to the pattern of coronary artery disease they have, or perhaps the severity of coronary artery disease that they have. In that situation, when the symptoms are not responding to medications, we would recommend more invasive treatments. Lifestyle changes are very important, both in the prevention and management of angina. The main things that we would focus on are control of blood pressure, control of your diabetes if you have it, control of your cholesterol levels, and also importantly, control of your weight and BMI. Alongside that, as you would imagine, it involves needing to have a healthier lifestyle in terms of diet and amounts of exercise.